when I worked in inner city Baltimore, I had a patient, Mr. M. I got to know him and like him quite well. I had coincidentally delivered one of his daughters when I was a resident, and then I took care of his wife and kids in the emergency room because they didn't have primary care, they didn't have insurance. And he was kind of the strong silent type. He worked a lot of jobs. They all slept on the floor at a relative's house. He probably had a few too many drinks sometimes to blow off steam, but he was a very solid husband and father, given their crushing poverty and stress. Well, one day he came in complaining of indigestion. It was the first time I had seen him. He hadn't seen a doctor in years, and his blood pressure was quite high, 220 over 130. I mean, really high. His EKG didn't look normal. I said, Mr. M, I need to put you in the hospital tonight. I think that we should get your blood pressure down and run some tests on your heart. And he said, oh no, thank you. I can't pay for that. I hear that a lot. I don't know exactly what to say about that. There's no answer. And so I did my best. I referred him to the social worker, and we tried to cobble together some kind of treatment plan on an outpatient basis. I started him on some medication and just hoped for the best. Well, over the years, his blood pressure stayed high, his kidneys failed, and he wound up on dialysis. Now, dialysis is hard. So I watched his quality of life plummet needlessly. I felt helpless, I felt impotent. This feeling of impotence, this knowledge that our patients are going to suffer, not because there is no treatment, there is treatment, and it's actually quite affordable, but just because it's not affordable enough for them. They somehow don't deserve it. That is what's causing physician burnout, at least a large part of physician burnout. Not only is this system cruel, but it's so expensive. Managing Mr. M's high blood pressure would have been a few $100s a year. Dr. Koch can back me up on this. I mean, it's easy. Dialysis is $88,000 a year, and Medicare pays for most of that, so we're paying for that. So we should have just paid for the $20 a month blood pressure treatment. But, dialysis is an example of how our system is failing. It's profitable. That's why it's happening. The typical dialysis center, I think, makes like $4 million a year. So it creates this perverse incentive to get more patients on dialysis by some elusive administrative, profiteer somewhere. That's wrong. These are real people. Dialysis is not an easy way to live. These are real people, and they deserve better.